if we share information, I'm going to ask Dr. Caplan about this, Dr. Arthur Caplan, Director of Medical Ethics at the New York University Langone, NYU Langone. Thanks for joining me today.
Hey, my pleasure.
Well, first of all, a little background. I went to pre-K at NYU, so I have a long-standing connection with that. And by the way, you guys have spread out all over the place, so it's good to see that branching out into basically every county of New York. So
yeah, that's true. That's true. From Long Island all the way down to Brooklyn into a lot of Manhattan. Yep.
So kudos to that expansion. Now let's get to the heart of this. Let's start with the ethics of this. How should medical professionals be dealing with this? Do you think even the CDC saying how it's going to erupt and disrupt everything, is that ethical? Like, how should medical professionals firstly deal with this coronavirus?
Well, I think the way not to do it is the way the president did it in his remarks the other evening, where he basically said, don't worry, it's not coming here, it's under control. I think that's painting too positive a picture. This thing's been spreading country to country. There's a new country almost every day. We're still seeing a lot of cases in some countries like South Korea that are new, or Italy. So you have to be transparent. You have to say to people, like the CDC should say, here's the worst scenario. We could get a pretty bad outbreak. We have a good hospital system. We can probably save people better than other countries if you get sick and you get pneumonia, which is what kills you from this thing. But it could come here, and it could restrict our lifestyles for a while. We could be not traveling in planes, and we might not be going to concerts, and daycare could close, so you got to get ready for that.
So when conservatives heard that, they kind of went nuts, saying that this was a ploy to take down Trump because there's a CDC official in there. But you think she was in the right to say, yeah, this is the reality of it?
I do. I think you got to calm the public down, whether conservatives like it or Trump likes it. I get asked like every other hour, should I be buying masks? Can I go to a concert? Can I go on a plane? Should I take vitamins? Can I eat onions to kill the virus? It goes on and on and on. People are nervous, not panicked, but they're nervous. The way to calm them down is not to say, hey, everything's good, or, somebody concocted this thing to get at Trump. It's a real epidemic. We see it's around the world. You got to hold their hand by saying, here's the best information we got.
Well, and let's shift to NYU for a minute. How are you guys dealing with this outbreak at NYU right up to the very minute?
So it's kind of interesting because we're ready, because we run Bellevue, we run big hospitals where very sick people come, and we've been down this road with swine flu, and we've been down this road with Ebola. We had an Ebola patient come to NYU. So we know if somebody presents themselves at NYU who says, I think I have symptoms, we don't take them into the ER. We take them into a special room where the doctors are gowned and masked and have the right protective gear to deal with somebody, and then we have spaces that are isolation. That's good for us, and that's great news. A lot of hospitals aren't prepared that way. They aren't ready yet. I'll flip that question around and ask you, let's say you were on a plane and then you had a fever and started coughing, and you're thinking, hey, maybe I picked that up. I was on a plane with people from China or Italy or someplace. What would you do?
Well, I would want to be secluding myself from everybody else and get it checked out, to be very honest with you. So
seclusion is important. You probably call your doctor, but do not just show up at the emergency room with symptoms. No. That's like showing up there with measles or something. You don't want to do that. We got to teach you, the public, what to do as well. People ask me, by the way, about that mask thing. I don't think the masks are going to work that well to protect you, but washing your hands a lot or using those Purell-like things, they help somewhat. But at the end of the day, it's basically having a good hospital system that's going to protect us the best, because we'll be able to hopefully do better than other countries in solving the pneumonias.
And by the way, if you're not sure of NYU's record, I'll just put this out there. If you missed what happened after Hurricane Sandy, the place I went to pre-K, actually, Rusk Institute, was completely flooded. Yeah. But you guys did an amazing job getting the babies out of there, getting people out of there, keeping them alive. I mean, that effort was heroic from you guys.
Yeah, and, we rebuilt everything. And so we're used to the toughest emergencies because it's a hospital of last resort. Where I'm nervous is you go to a little hospital out in the middle of Pennsylvania or the middle of Montana, and you say, I got off this plane, or I was in contact with somebody and I think I might be sick. I don't think we've told those folks what to do. I don't think they know how to handle it. I'm not even sure, let's say somebody was sick, I'm just going to make this up, in Allentown, Pennsylvania, and they said, let's take them to a bigger hospital like Lehigh or even all the way to NYU. Who's driving them? Can you call an Uber? Can you go in a taxi? Should you call the EMTs? Should you call the cops? We got to work all that out. That's preparedness.
Right. And by the way, there is an unconfirmed origin case right now. Why is that so alarming? What realm are we entering now with that unknown origin of it if they weren't winning?
Yeah, when somebody says they're sick or they seem to be confirmed to have the disease, usually we can trace it and say, oh, well, you were in Wuhan, China, or you flew in a plane with people who were sick, so we know how you got it. When it just pops up here, it means that somebody was infected that didn't perhaps show symptoms that infected you, and now how many other people did they infect? So it's like maybe that virus doesn't make everybody sick, but they could be carriers, and that would be bad news because it's really tough. You can't quarantine. You don't know what to do.
Well, let me ask you this. This one, I think it's the same case. They said it took days to process. How is that possible? Like, I thought our government should be a little more on top of it than wait days to actually diagnose.
Well, one problem, we don't have the test kits everywhere. So there are test kits to say, yep, you got that virus. We use it sometimes to say, yep, you got the flu, or yep, you got some other disease. But we haven't really pushed those out so that people could be doing the testing. That's a failure. That's big time. It's not just treatment you want, but you want to be able to test right away if you think you got people who are sick. And again, I'm sure NYU has plenty of tests, and I'm not sure that the little hospital in California where this guy might have gone does.
Well, and I want to ask you this because on a national scale, while all this is going on, they're right on our TV screens, war words between Trump and Pelosi. And I mean, the politics of this is getting disgusting, and I wish both sides would work together if we want to fight this epidemic. Wouldn't you want to see unity on the Hill?
I do, and I also want to see a kind of recognition that, look, you're not going to beat this epidemic by politics. You're not going to beat it by ideology. You're going to beat it by science. I know Trump said Pence is in charge, and then somebody else said, well, Azar, the HHS secretary, is in charge, and it's not clear who's in charge right now. That's bad. You want to be coordinated. But you know what? I don't want any politician in charge. You know who I want to hear from? CDC, NIH, and where's the Surgeon General? I think we have one, but I haven't heard from him.
Yeah, I know. I haven't ever heard from him. Huh.
Let's hear from those guys. The science is what's going to win this thing. I don't care what the markets think, and I don't care what's going on with the political posturing of who's yelling at who. The politicians have one job to do: appropriate enough money to get whatever we need to protect ourselves, get it done, and then get out of the way.
And from a human perspective, because, I mean, not that these guys on the Hill are not human, but they don't look at it from that. They look at it from political. From a human perspective, doesn't it just make sense at this point, if you are feeling sick, to just not show up to work, to not even travel? I mean, isn't that the basic common courtesy?
Yeah. Yes, and I think you stay isolated until you know what's going on. Remember, you could have something else or other things that mimic these symptoms, so you may not have it. And the best thing to do is stay away from others. It's funny. The time to put on a mask may be if you think you have symptoms. That protects better from giving it to others than it does protecting you from getting it.
Right.
So that might be the time to whip out the mask. And then, look, we got another problem in this country. Like it or not, there are a lot of people running around out there without health insurance, and there's some people running around out there who are undocumented, right? They don't want to be found.
Right.
Well, we ought to say to them, look, if you have symptoms, we're not going to deport you, so come on in. If we don't, then they're going to be running around infecting people.
So you're telling me that we're not encouraging an entire sector to just be open about this, is what you're saying. That's what's missing in the dialogue.
Yes, and you got to be transparent, and you almost have to have an amnesty period that says, look, I don't care who you are, I don't care how you got here, I don't care if you have a green card or you're illegal or you're a prisoner. You have symptoms, you tell us, you tell somebody, we'll try to take care of you. That's the way we protect everybody. In this case, when you got an epidemic, when there's a pandemic out there, we're all in the boat together.
Well, let me ask you this. How is NYU with opening up their doors to undocumented, to people without health insurance?
We're good. So, city of New York, gives us some money to run Bellevue. We don't turn people away. And to be positive about our healthcare system, a lot of the ERs will not turn you away either. However, the problem with infectious diseases, you don't really want to start at the ER in most places. You want to come in another way. So again, you want to tell people before you go down to that ER, before you get to the hospital, either you have your doctor call and say, where does he go? Or you call and say, I think I'm sick. You want to meet me at the back door. But at NYU, we'd get you in.
Well, let me tell you, you just mentioned, and that's a good thing. I always feel like the narrative is never directed at positives anymore. It's like there is some fear-mongering and scaring going on, even in the media, to tell these people, hey, you shouldn't go anywhere because you won't be accepted. But to have folks like you, Dr. Caplan, on there say, yes, we will accept you, that changes the narrative a little bit.
Yep, and I think, again, docs know at our big hospitals like NYU, and to be fair, Columbia and Montefiore and Penn and wherever, University of Chicago, all these big joints, they know how to protect themselves. They're not afraid to treat you. They'll put on the right equipment. I'm a little nervous if you call up your family doc and say, I think I got coronavirus symptoms. They're not going to be so welcoming, not because they don't understand that they should try to treat you, but they don't know how to protect themselves, or they don't have the equipment in the office yet.
Well, and I just yes, and so protecting yourself, I mean, it does go beyond washing your hands, doesn't it?
Yeah, I think you can wash your hands. Some other things we shouldn't do. Let's not spit in the street. I see people doing it. That's a horrible thing to do in the middle of an epidemic.
I'm kind of guilty of that.
Let's not be shaking our hands. Let's do the old fist bump. That's a nice way to minimize contact. And I think it's important to make sure, you don't do unnecessary things like head out to concerts if we start getting cases, try to stay home. Somebody said to me, should I buy masks? I said, look, why don't you keep enough food around for maybe a week or two, because you might be withdrawn a little bit. That may be the safety measure you take. And then pay attention to legitimate news. Don't be reading all the social media stuff about eating onions and drinking bleach. None of that stuff amounts to anything. Don't do that.
Talking with Dr. Arthur Caplan, I got a couple more questions for you because this discussion is there's so much to cover, and I hope you have a few minutes because I got a lot to ask you. You just mentioned about
I got 5.
You just mentioned the concerts, and they are canceling a lot of different events because of this. So you're saying that's not an overreaction; that's a real thing, and we should be.
Yeah, and I think we'll see more of it because if the epidemic really gets there and we really start seeing some cases, you don't want people coming together. If it can prevent it in big spaces, that is a place. Flu gets transmitted that way. It rolls through communities. You can see it breaks out here, breaks out there, but it's linked up to when a lot of people are together indoors. The reason the flu kind of goes away in the summer a little bit is we're outdoors and we're not on top of each other as much. So it doesn't solve the problem, but it slows the spread of the disease.
So does this hit the Olympics? Do you think that ends up being a big cancellation in the long run?
Yep, I do. If this thing lingers through the summer, when is that? July for them, I think.
August or July,
yeah. I think it could get canceled. I do. And you're going to see some other sporting events. I noticed that some of the baseball games in Japan have already been canceled, spring training type stuff. So, yeah, we could see that. That's the bad news. The good news is it won't last forever. I mean, this one way or another, we'll get a medicine for this thing or a vaccine for this thing, but maybe even just getting a break in terms of, as I said, summer, people less congested together. Maybe that'll help. And it is the case that every once in a while the virus just mutates. Something that was nasty becomes better. So there's light at the end of the tunnel. It's just not going to be fun going through it.
City response, are you happy with the way the mayor and the city has responded to this? And he actually said to the media, hey, don't increase panic. So I want to ask you the city's response, and then what's the media's role to not make us panic?
Media's got to be out there and go into the sources. I'm a little nervous that right now the administration is saying you got to get all the information from Mike Pence. I don't like that because I don't think Mike Pence is trustworthy on the part of the public, not me. It's not political. It's just he's not a scientist. He's not a doctor. And, he's a political guy. We all know that.
Right.
Put Anthony Fauci out there. Put the commissioner of health of the city of New York out there. Put the state health commissioner out there in New York. Let's have this is a time for doctors. It's not a time for politicians.
And then the city's response, how do you like the way the mayor and our city's health department is dealing with it?
Well, they do seem to be, ready to put the resources in. I would still like them to be talking to all the hospitals so that they know what to do if somebody comes in with symptoms. Maybe they are. I haven't heard it yet. If they are, I'd like to hear about it more publicly. And I'd like them to say more to reassure the public about, here's what you can do. Here's the things that you might need to do if cases break out. Get ready for that. And it's as basic as saying, if we get an outbreak, there may be no daycare, there may be no school. Talk to your employer about you may need to stay home for 2 weeks.
Oh, that would be rough. But Dr. Caplan, thanks for keeping us safe. And I think Anthony Fauci is a New York guy as well, is he not?
He is. So, I think he's from Queens.
Yeah, so it's a New York effort here. And
there you go.
Thanks for joining me today, and we will talk to you soon.
My pleasure.
And you and I are friends with Frank Morano, and he gave me the blessing. So thank you for joining me today.
My pleasure.
I'm Alex Garrett. Please stay safe. Please know the symptoms. Please be informed. That's the big thing. And we'll do our best here on Keeping It Real with Alex Garrett.